Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to talk to you about an important defensive function, and that is dissociation. I'm going to be talking about why and how dissociation tends to interfere with your daily lives while you are dealing with gender dysphoria. I will do a separate video talking about whether dissociation tends to continue once you do transition, whatever that means for you, and why it tends to continue and how it can potentially be harmful to you. But today we'll be talking about dissociation as a defense while you're dealing with gender dysphoria. To clarify, I'm not talking about dissociative identity disorder, which is formerly known as multiple personality disorder. I'm not talking about any of the disorders today that may include dissociation in it. I'm talking today about dissociative defense. So what is the defense mechanisms? Well, as human beings, we have a number of psychological defense mechanisms that we tend to employ, especially when we're going through a difficult time, a very stressful time, very traumatic time, a time that is very hard to cope with. The reason why we employ defense mechanism is because we are trying to help ourselves to cope with the event. Defense mechanisms, and dissociation just part one of them. There's a numerous amount of them. Just think about repression, regression, denial, avoidance. All of those can be defense mechanisms. Defense mechanisms in of itself are really, really good. They're really important part of our psyche. Why? Because if you're going through a traumatic event, and you employ one of the defense mechanisms, it can help you from having a nervous breakdown. It can help your mind from disintegrating. It can help your mind from falling apart. And then sadly, when the mind does fall apart, depending how drastically it falls apart, sometimes it cannot be put back together. So defense mechanisms are very, very important part of our psyche, and you'd be surprised how often you employ defense mechanisms on daily basis throughout the day without even being aware. Now, defense mechanisms are all start out to be adaptive, meaning they're adaptive in a sense that they're actually helping you, right? So you're dealing with something that is difficult, you're dealing with something that is very stressful. Defense mechanisms helps you to cope with it better without, again, falling apart. So it starts off being very adaptive and helpful. The problem with defense mechanism is that they eventually, a lot of times, become maladaptive. They become maladaptive because we get habituated and we become kind of a slave to those defense mechanisms, or we become really used to dealing with them or using them versus dealing with our issues. So as a result, they become maladaptive because they're no longer helping us, no longer really serving us. I mean, just think about a defense mechanism of denial. At one point, maybe denying something that's very painful that has happened to you may have been adaptive, but if you continue to utilize denial mechanism, it's really not serving your life, because you can't just continue to be in denial about something that's actually taken place on an ongoing basis. So going back to dissociation. Dissociation is a defense mechanism that should be very, very common to majority of you. I use the word should because in my experience, 90% of transgender people I work with, one way or another, experience or have experienced dissociation. A lot of times, a lot of you have experienced dissociation on an ongoing basis. One of the biggest signs of dissociating is having an out-of-body experience. It is feeling as if you are floating outside of your body. It is feeling as if you're looking at your body from a different vantage point. That is one of the most common experiences people tend to feel, which makes a sense why dissociation would be number one defense mechanisms that is being utilized by transgender people, because the primary reason of being transgender is that this incongruency and discomfort with the body, especially in relationship to what gender it tends to communicate to the world. So of course you're going to try to avoid this vessel. You're going to try to detach yourself and really separate yourself from the vessel that you don't identify with, that you don't feel congruent with, that you don't feel really represents how you see yourself in relationship to your gender. For that reason, dissociative defense becomes very dominant for a lot of you. Another cause for dissociation, apart from having this experience of out of the body, is numbness of your feelings. Feeling numb to emotions, feeling numb to the affect, which is called emotional detachment in a way, where you just emotionally detach yourself and you don't feel what's going on. Another is where you are daydreaming, or where it feels like you're outside of your head in terms of your headspace. Also where you feel like you lost track of time, or where you're wandering somewhere and you don't know what you were doing for the past 2 or 3 hours, kind of like complete blackout in a way experience. All of those are signs or symptoms of dissociation. Again, dissociative defense for a lot of you is going to be very, it's important, right? Because you can't always feel grounded and comfortable with your body, because the sole cause, again, is that you're not feeling comfortable. So you're going to feel really dissociative. It's the way your loved ones are going to experience you and people around you. They're going to experience you as if you're there, but you're not really there. That's how I usually describe it. Usually when I work with clients who have incredibly strong dissociations, they'll be in the office with me, but they'll be looking at me, but it feels like they're staring through me. It feels like they're not present. It feels like they're not there. And unfortunately, that's one of the issues with dissociation. As a result of that, you're going to struggle with people relating to you, because if you don't, not present, and if people perceive you as not being present, that's going to cause interpersonal issues. People don't know that you're dissociating because you're struggling with gender dysphoria. People think that you're spacing out. That's another way to describe it, is that it feels like you're spacing out. And the way people experience you is that as if you are spacing out into the space. And so it's going to cause ripple waves along, around your relationships, because people are going to think that you are not paying attention to them. You're not interested in what they have to say. You're not being present with them. So your partners, you may have heard your partners complain about this. You may have heard your loved one say you're not present, especially during any kind of encounters where you are put in a position where you are especially have to be more in touch with your body. Sex is a great example of that. How many of you have heard your loved ones tell you, hello, I feel like I'm having sex with an invisible ghost. I feel like you're not present. Where did you go? I feel like you're not here. I feel like you have disappeared. That's because during those instances when we should be more connected to our bodies, for you, you're going to be utilizing the defense mechanism even more. Other instances maybe where you are put in a position of displaying your body, summers, being in some kind of swimwear, being somewhere where you have to undress yourself, locker rooms, dressing rooms, all of those areas are going to make you dissociate even more. Why? Because you are exposing yourself in a way, you are exposing your body. So dissociative defense, you have to keep in mind, is, it's for a lot of you, it's going to be part of you dealing with gender dysphoria. And a lot of times it does help, because if you're not in touch with how you feel about your body, then you don't have to endure and feel the pain. Now, of course, the pain is still going to be there, very much so. But for the short period of time that you employ the defense, you're not going to feel it as much. So dissociative defense, again, it's important part. Well, I don't want to say important part, but it serves a purpose. It helps you to cope and deal with gender dysphoria. This is why so many of you who are older have managed to live with gender dysphoria for a big duration of your life, because you have employed this defense along with every other defense, and you think you're doing just fine, when in reality, you're not doing just fine. Remember, defenses are adaptive in the beginning, always, and eventually they become maladaptive. So now it may have been adaptive for you, but how adaptive is it if you're really not present for your loved ones, if you're really not there for your family, if you're really not there for your partner? So that is a defense mechanism while you are going through gender dysphoria. I would bet my money on the fact that a lot of you have experienced dissociation. You may have not known what it's called. You may have not had a word to describe it, but I bet a lot of you have experienced it. And it's really unfortunate because it's, as much as it's adaptive, it's very quickly becomes maladaptive. In the next videos that I'm going to do, I will talk about whether dissociative defense tends to manifest or tends to creep in into your life once you transition, whatever that means for you. Why it tends to still be there, even though now you're congruent, you feel more comfortable with your body, and how it can actually be harmful. So comment below, let me know whether you do feel dissociative defense, how it manifests in your life, how it interferes with your life. Do you feel yourself distancing and not connecting and detaching from yourself? Because that's what it does. It really makes you feel incredibly detached from yourself, and that can be also be hurtful. So comment below, share, let me know, and I'll see you all next time. Bye.